Hello, everybody. My name is Jarom Prows. I am the Director of Support Services here at Fort Defiance Indian Hospital, currently acting in the capacity of the Incident Commander for the COVID-19 rollout. We have been working in this capacity really since November of last year is when we started the planning phases for the vaccines coming out. At that point in time, we initialized the Incident Command. The Incident Command team is separate from the main hospital's Incident Command, and that team follows the same structure, but it's a little bit more condensed. We still have a safety officer who is Emerson. We have our communications, which is Dallas Ellsworth, and then we have our liaison, which is Robert Otero. We have our operations chief, which is Commander Leah Earl Begay. Then we have our logistics chief, which is John Moleto. And then we have our finance chief, which is Terry Linez Chi. And then we have our planning section chief, which is Aaron Clark from pharmacy. Together we have developed a plan to implement and roll out the vaccine to the community. As of today, we have administered over 11,000 vaccines. That compromises of the first and second dose. Obviously our first dose numbers are gonna be a lot higher than our second dose, but we have a plan in place to get everybody their second dose, their booster. Last I checked, we were at around 90% of our hospital employees have been vaccinated with a complete series, that's first and second doses. We are currently in phase 1B of our phased rollout plan. Phase 1B consists of high-risk patients, individuals who are 65 years and older, spiritual leaders, and a long list of essential workers that have been identified via the Navajo Nation Department of Health and their release. Based off of the data that we pulled for our service area, we are currently sitting at around 48 to 50% of our total population that have received at least the first dose of the vaccine. We're following up with those boosters. So we are making a pretty big impact in our service unit. We have started seeing the numbers kind of decline when we're doing our mass vaccination events. So we have one more mass vaccination event planned. That's the booster for March 11th and 12th. That's booster only. But after that and going forward, we plan on taking a little bit more of a controlled, scheduled approach. You will be seeing advertisements come out via our social media and on our webpage, where we will be instructing individuals and patients to either click on a link and self-register and or call a number to schedule an appointment. We're still working out those details, but we are going to be going towards an appointment-based approach going forward. We plan on doing this 4 days out of the week with 250 doses per day, which will average out about 1,000 doses for the week. Those are going to be more of an open pod approach. We are also planning the Nahat'ah Dziil clinic. Last month in February, they did 400 vaccines, not including the event that we had out there on Sunday. But just internally in their clinic, they did 400 vaccines. This month of March, they plan on doing another 400 vaccines as well. They will be administering the Moderna vaccine, and we will be doing a combination depending on the quantities that we have of Pfizer and Moderna. So I talked a little bit about the data and how we're using that to schedule these appointments going forward. We are looking at the percentages of the chapters that are on a little bit lower end, that don't have a higher percentage of their population that have been vaccinated. So then we're gonna start looking at trying to take a more strategic approach and send out mobile teams to go out to those chapters and hold smaller events of 100 doses at a time, to try to really get those hard to reach areas. We understand that here on Navajo, we live pretty far out. Some people, it might take them an hour to 2 hours just to get here. It's not as easy as it is for others. So we are looking to try to capture as many people as possible and trying to be creative with our approach going forward. In closing, everybody, I just want to say a huge thank you to everybody that's been involved. This has been a constantly moving effort going forward. All of us have pitched in. If you were out there during our mass vaccination events in the cold, thank you. The mobile health team, thank you for going out there and hitting our congregate settings, some of our grocery stores in the area. Thank you for doing that. And then everybody here that has taken on a role that isn't necessarily in their job description. Here at the hospital, inside our mission statement, it says to raise the level of health, vision, and quality of life. What better time to do that than now? So thank you all for stepping out there and really helping out. We couldn't have done it without everybody else's help, so we appreciate that. Remember, even though we have the vaccine, We can kind of see the light at the end of the tunnel, but we're not there yet. Remember, practice your social distancing, continue to wash your hands and wear your face mask. Thank you, and we look forward to continuing this fight against COVID.